The President has authorised the SIU to probe corruption and maladministration at health departments. It will now investigate people and contracts that go as far back as 2013. Special Investigating Unit Spokesperson Kaizer joins us now to discuss this further. Mr. Kganyago, good morning and thank you very much for your time. This is honestly a very important proclamation that will assist the Health Ministry in establishing if indeed the medical negligence in the health sector has gone up to the extent of those claims or it's pure corruption. Just take us through the terms of reference.
Thank you very much, Mfundo. Maybe I should take you a little bit backwards where I indicate that we had started this investigation on a secondment in Gauteng and in the Eastern Cape. And in our investigation, we found clearly that there was a cabal or some syndicate that was working in the departments to make sure that they con or take away money that is meant for health services by claiming exorbitant amounts of money, and they are working with the nurses and the doctors and in some instances lawyers and so on. And therefore that led us to request this proclamation because the amounts that are being paid take a big chunk of the budget of all the departments in government or the Department of Health. Therefore, that is why this proclamation is now giving us all the 9 provinces and the national department so that we look at all of them as far back as 2030.
This is honestly unfortunate because then clearly we haven't been getting a true picture of the extent of negligence in these public hospitals, because at times you find doctors are said to lack the requisite skills. Then doctors would come out and defend themselves and say, you know what, the ratio of doctors or nurses to patients is too huge, we cannot cope. But really with all of these reasons, you had a health sector that could not fully diagnose the problem and then begin to address it because we actually didn't get a true reflection because of these medical legal claims. But what you touch on is very important because it was my next question around the element or aspect of collusion here that one assumes it cannot just be lawyers here. You've got the nurses and doctors who then would either write those expert reports, and then it allows for this matter to actually go ahead in court and you get that fictitious medical legal claim. So clearly your investigations are going to be quite broad beyond just lawyers.
No, definitely. It is not only going to look at lawyers. Like I've said, we already have examples in the Gauteng and in the Eastern Cape, where even one of the lawyers is already being taken to court about this matter. But we have found that it's a clear collusion between the nurses who then leak the documents from the hospitals themselves, and then the doctors who then pronounce that the people are medically the way they are, maybe to an extent of even saying that some of the people are mentally disturbed and they cannot work for the rest of their lives. Therefore, government has to pay for that so-called negligence. And after the money is paid, the people are well and they take the money and enjoy the money as if nothing has happened. And they were declared to be in a position where they cannot even look after themselves. And such things are very clearly indicated in the previous investigations we have done. And now we want to get to the bottom of it. And those that are involved will have to be taken to task.
But one wonders then, insofar as consequence management is concerned, would there be any sort of sanction on the nurses? Because one would assume if there is now a claim of negligence at the hospital, here is a nurse that's forwarding this to lawyers, they take this to court, they win. What happens to the nurse that would have been fingered in this process? Or in most instances, it becomes a generic fault where they say the electricity wasn't working or we didn't have enough oxygen at the time. Would there be no consequences for a particular nurse that is fingered or found to have been negligent in such an instance?
No, there will be, because at the end of our investigation, we then indicate clearly that those people that are working for the department that are found to have been in the wrong, they have got to be taken to task by the department to make sure that they are disciplined, and that is where we are in relation to that. And we can only leave that to the department to make sure that they are disciplined, and where they are found guilty, they need to be punished accordingly. But also, the element of where people are deliberately doing this, we refer that part as a criminal matter to the NPA to make sure that they are now, even in some instances, they resign, and then they can then be taken to task criminally by the NPA.
We know that with cerebral palsy, in fact, it seems to be the one that is attributed to negligence quite often. Have you dealt with any other cases
No, we have. We have dealt with cases in Gauteng, and we have dealt with cases in the Eastern Cape. And like I said, there is even a lawyer that is now appearing before court in the Eastern Cape around these issues. That is how far we have gone. Therefore, we are clear about the fact that there will be consequences, and we are also looking at other, besides cerebral palsy, we are looking at other reasons that are given to make sure that we deal with this thing. And it has been something that has been happening not only in the Department of Health. We have dealt with it when we were dealing with RAF previously also. There were similar kind of things that were happening, yes.
No, it will honestly be interesting to see the outcome of these investigations. But one obviously assumes this is quite a wide or long investigation process because it's a wide scope. So how long would it take to finalize these investigations?
Obviously, the proclamation was only signed or gazetted last week, Friday. We are now in the process of making sure that each and every office of the SIU, because it is all the provinces are involved, then gets what is supposed to be investigated in those provinces. Letter of engagements are going to be sent or are being sent this week to the departments concerned, and then the investigation will start. Obviously, because we are going back as far as 2013, we'll have to gather information and then take it from there.
It's going to be a lot, but will perhaps we, as usual, get some sort of a preliminary report which will be sent to the president at the very least, just perhaps to isolate those that are alleged to be continuing with wrongdoing so that they may be suspended or just taken, removed for a bit out of the system? Will there be some sort of preliminary report that allows for some sort of movement in these hospitals?
Yes, when we do our investigations, regardless of which investigation it is, when we get outcomes at any given stage of the investigation, we don't wait for the end. Those instances where we have outcomes, we deal with them. If we have got to take that section to the special tribunal, we do so. If you have got to send referrals for disciplinary or referrals to the NPA in the middle of the investigations, we do so that we can deal with it as and when it goes forward.
All right. And then just taking you back to the investigations from before, that's in the Eastern Cape and Gauteng, were you able to recoup any monies for the hospitals?
Yes, there are some of the matters that are before the tribunal for that purpose, to get the money back, and then we are recovering that money as we speak.
All right. Mr. Kganyago, thank you very much for your time this morning. That was Special Investigating Unit Spokesperson Kaizer Kganyago.